I've already introduced myself, so I would like to ask each of you to just give a brief introduction of yourself for the audience.
I'm Dan Borison. I've had a practice of general surgery in the Cleveland area for a little over 20 years. I've also branched out recently. I've become the chief medical officer of a company called AmeriWound, which provides wound care services in nursing homes in Ohio and 5 other states at this time. In addition, I have formed a consulting company to offer chief medical officer services and advice to those companies in the medical field that are earlier in the growth and the startup process.
Thank you, Dan. Good morning. My name is Sara MacKinlay, and I am the general manager of Exsurco Medical, which is a startup medical device company in the Western Cleveland area. And my background is really on the device manufacturing side. I've spent many years, and yes, it's much more than 20, in various roles, leadership roles for companies such as Johnson & Johnson and Smith & Nephew, and delighted to be here.
Great.
Hello, I'm Rehan Waheed. I'm an internist, but most of my time right now is a senior director in our Department of Integration and Transformation, specifically the Results Management Office. So it's do it, if it makes sense, and then it's the RMO. Previously, I'd spent a lot of time consulting with Better Health Partnership as well as doing hospice work at the VA, so kind of been in multiple systems in the area.
Great. Well, we're going to talk about a number of different topics today, and the topics that we're going to cover are clinical champions and how hospitals assess value, the hospital buying process, come back to the subject of value assessment committees in a little more detail, and then get some insights from the team on how to prepare to sell to hospitals. So starting off with the topic of clinical champions. Sara Ann, can you start us off by telling us why a clinical champion is so important?
Absolutely. So maybe to first start with clarification of what is a clinical champion. And I think I'm kind of in a very envious position. I have 2 sitting right beside me. So, you know, a clinical champion in your institution is, you know, preferably a physician, which again does depend upon the product and service that you're selling. But a clinical leader who really has vetted your product, has an interest in you being successful with that product, sees the benefit of the outcome of the product to the institution, and can really help a manufacturer's representative navigate a very complex process. I think as you saw from Jacqueline, there are many steps, many people, many stakeholders, and the clinical champion can really go step to step with the representative and help them through that process. So they are critically important, and I think, again, to reiterate, they have vetted the product and believe in its potential outcome and value to the hospital system.
Mm-hmm. And those of you that are clinical champions, what are the attributes of a good clinical champion? Rehan?
So, you know, what I see, it's, again, as we've shared, it's a partner. So someone that truly knows a product, and it's not always just the initial implementation of that, but how it could be used system-wide. And it's really important to see it as a value add for the system, whether it's filling in a gap, whether it's doing something differently, whether it's really bringing something revolutionary to healthcare. So some of the things that we've been looking into are things like machine learning. How do we utilize that in various areas? Where previously healthcare hasn't used that, and other industries are, and we should definitely take advantage of that opportunity. You know, you want a clinical champion, as you can kind of see on the graph, as probably an early innovator, possibly an early adopter, but really looking for those innovators that are going to be that champion to move it through the organization.
I think that's 100% correct. The only thing I would add is you want someone who does have, I believe, a lot of clinical experience as well. When you have a good clinical champion, you want to have somebody who understands the hospital environment, who works in the hospital environment. Typically, that's going to be someone who's in a leadership role in the hospital, whether president of the medical staff or at least department head or department chair. And this is going to be a person who's very comfortable, familiar with the types of products that are out there, but also has a good relationship with the administration of the hospital so they can interact well with the value-added committee and the other administrators. And I think finally what's going to be important, I think we're going to talk about it more, is once you get that product approved, it's not enough just to get it approved, it has to be used. So you have to get the buy-in from the rest of the clinical staff to make sure that the product is going to be encouraged.
Yeah, you touched on a really important topic, and that is, what role does the clinical champion play both in the sales process and then after the fact? So that's a really important aspect. So can you elaborate a little bit more on some of the things that they might do that go beyond just the sales process?
Sure. Just as an example, I've been involved in some products like mesh, for example, for hernia repairs. You may have the, as we talked about before, the group purchasing organization, which has a certain type of mesh, but you now have a different type of mesh that you think is going to be great and it's going to really help things differently. Well, you need a clinical champion to use it, be familiar with the product, and to help you identify why it's going to be better. Then you need to ideally point out how it's different than the products that are currently on the group purchasing list, so that this will be an exception to that 80% rule. But finally, once you get that product available, you need to convince the other surgeons within the hospital to use it and to demonstrate that it's effective. It helps, again, with value. And I think we're going to talk about value and what value means, but how it is valuable to the organization.
Yeah, Dan, I'll just add on to that. The clinical champion, when partnered with the manufacturer, can really help critique, develop, enhance the value proposition for the manufacturer so that the message is really spot on for what the surgeon, the value analysis team, and the hospital needs. So exactly as you said, there's a clinical component, there's the economic value proposition, and I think when companies tend to try to do this on their own without the involvement of the clinical champion, I think the outcome for success is much decreased. So that's an excellent point.
And it really should be thought of as a win-win situation. So it's a win for patients if we do the right thing for the patients. It's a win for the system if we get the system what it needs, and it's a win for the company because they have an opportunity to grow.
Well, these sound like incredibly important people. So how do we find one? So how do you recruit or select a clinical champion?
I think that the best way to recruit a clinical champion is if you are in the market and you know people in the field, in the hospital in particular, and often your sales force will have some connections already. If that's not the case, then you may want to have I think personal connections between your chief medical officer, your clinical development staff, who may be able to identify people in different organizations that can help as well. And there's a number of ways to do this, whether it's personal involvement or simply searching databases, but I think a personal referral and a personal connection is going to work a lot better.
I would agree. A personal connection is great. Networking opportunities at various social events. Social media LinkedIn has been used, at least for me. I've been reached out in that manner to, hey, can you evaluate this product? Can you let us know and provide some feedback on what we should do, shouldn't do with this work? So there's lots of avenues, whether it's direct or indirect.
Yeah, I just echo the networking. Social media just gives us such access that we haven't had before. But maybe just also some old-fashioned footwork that has to be done, and really understanding that the hospital that you're selling to, the nursing and clinical staff can give you some great insights around who's the it person, who's the person that has just the incredible influence across the hospital. So doing that kind of research on the product and on the actual institution, I think, can generate some great information as well.
Great. Well, the next topic that we're going to explore is understanding value from the customer perspective. And certainly that's foundational to your product development. It's important for your value proposition development, your claims strategy. So really getting into the head of the hospital and how they assess value, I think, is a really important topic for us to dig into next. So first of all, can we just kind of get from you, maybe Dan, just some thoughts on what are those axes of value that the hospital...
How to assess value?
How to assess value.
So I think the obvious would be, is this a quality product? And you need to have a product that benefits patients and improves the outcome of clinical care. And then again, the obvious would be the cost of this product. But there are a lot of other factors that are possibly less obvious. For example, does this product save time? Does this product allow less employees or less staff hours to be involved? Is it easier to schedule something because the previous product required a certain room that was bigger or had certain electrical or environmental conditions that needed to be enforced, and this is a much easier product to use? It could be a situation where, yes, this product is actually cheaper, but if it's not part of the group purchasing list, now every other product that the hospital uses is going to now be 5 or 10% higher. So in the end, it may not save you money too. So there are a lot of factors that need to be analyzed for value.
Mm-hmm.
In addition to that, one of the things that I would keep in mind is how the hospital is getting paid and what does their payer mix look like. So if the hospital is moving towards various population health models, so when you're going in and trying to purchase particular devices or think about the type of services they're going to be going towards, whether it's more well care rather than surgeries or trying to move people towards prevention, certain things are going to be higher on their list versus others. If they're more CMS paid patient populations, you've got to think about that versus commercial versus self-pay and how that will play into the picture. Mm-hmm. So I'd add that onto everything else you've said.
Mm-hmm. So how does an organization, demonstrate value to the hospital? What are the things that they need to do to really show value?
Well, I'm really struck here by, our physician panelists, and I think the message to the manufacturers, it's really so much more than just the widget. And I think, the days of selling features and benefits of the product, I don't think the two esteemed doctors are going to be so impressed with that. It really has to be looking at the total picture of how your device, how your product is really going to be accretive to the healthcare system. So it's that marrying with clinical and purchasing and really getting this all wrapped up with a nice bow and really assuring that you can accurately and adequately demonstrate value. And of course that involves having some data, having the right data that the constituents are going to look at. But it really does, in my opinion, up the game. Walking in with a rep who can really speak the virtues of the product just isn't going to cut it today.
Mm-hmm. Are there differences between the way a hospital would assess value for different kinds of products?
I mean, for me, most of my work has been in non-operative settings, so for you can talk about that, but I think there is going to be some common themes. So as you've shared already, what's the quality look like? What's the cost look like? Is there an efficiency gain? But what I look at is how does this affect at a system level? So I don't want to make a purchase or a change that's only going to affect a particular department, and then I've got to buy a similar product from another vendor to the exact same thing in a different area. Mm-hmm. If I can buy one thing that can be utilized across the system, it makes more sense and gets back to how do we standardize, how do we leverage through opportunities of scale to be able to do that.
Mm-hmm.
Yeah, and I think it ties into what Sara just was saying as well. You really need data and metrics to present your product. You have to show exactly how it's going to do, not only in the clinical studies, but in this data that's going to affect purchasing and use and other contracts.
Yeah. So what types of studies and things would you think people should do prior to launching a product into this space? Do you have some examples that you might give of some things people have done to generate that kind of data?
Sure, I think that it's going to vary widely. Obviously, if you're looking at a new medication or a complete new product, you're going to need FDA approval and those kind of studies. You're going to probably want to have randomized, double-blinded clinical studies across multiple institutions that are going to validate this product. On the other hand, if you have something that's a little different than products already being used, it's a much different process. What you're going to show there is why this product that's slightly different has been shown to be effective, save costs, add value. And that can be done in a little bit of a smaller study. It may be that you have one hospital or hospital system or physician group or team that has used this product, and then you can use that data to show how it's helpful.
Mm-hmm.
How
So piloting, I think, would be great,
Exactly.
and then making sure that you have a good partner when you pilot, so that way, as you're going around talking to others, you have an opportunity to say, we've piloted with so-and-so, you're welcome to go and talk to them, interact. That's one of the things that we do, at least, is if we're thinking about something, we want to talk to someone else that's using it, if they exist. And what are they using it for? How is it going? What pros, cons have they experienced? So we really have a better understanding, not just from, a study, but actual real-life use.
Jacqueline, I'll just add to the comments. I think the onus is really on the manufacturer through the development process of the product, of getting very diverse and very vibrant voice of customer feedback. So right down to simple, what would seem to be simple decisions like how you package a product, understanding that impact to the healthcare system and having that well researched and vetted beforehand can have great benefit as well. So right from the packaging to the clinical outcome to, Dan, you mentioned the kind of the efficiency data. Could this potentially make your OR more profitable? Could this potentially make, the cases that you're seeing in the OR a shortened time? So having that all well vetted and part of the development process, I think, is really key.
Great. Well, this whole session is called Opening the Door to Hospital Sales, but probably one of the challenges that sales reps face every day is actually getting in the door. And so, Sara Ann, I wondered if you could start us off with some of the logistics that your teams encounter as they're entering the hospital, getting in.
Yes, and I have a vast library of the do's and don'ts, but I'm going to focus on the things to do today. And, I think as we've heard here, the complexity of an individual hospital, the it depends answer is really understanding what are the requirements of that institution. So everything from credentialing, which is very big today. I think I'm not going to be able to walk in and visit Rehan this afternoon and kind of see him in his office, nor Dan. You have to have the proper credentialing. And that's a process. That's not going to be, I'm going to stop by this afternoon and get myself credentialed. So you really have to understand that policies and procedures. You have to seek to understand and really understand what it's going to take to get your product to the right decision makers and do it appropriately. And training and training. And it's not just product training, it's everything from understanding how you get to understand the policies of the hospitals and how you, of course, appropriately execute them.
And not underestimate the time and expense that goes into getting into a hospital.
Oh, completely. I'm always my eye on any representative who can tell you I can get that product in my forecast in the next 2 months. And it's pretty easy to spot those that haven't done their homework. It is about preparation. It is about understanding the sales cycle, which, again, depending upon the product classification, if it's capital, if it's soft goods, are going to vary greatly. But you have to understand the budgetary cycles of your institution before you begin to talk about when I'm going to make a sale.
Well, how do you get to understand the customer's policies and procedures? What's the best way to go about doing that? I mean, I'm new. I don't know. What do I do?
So again, going back to clinical champions, so having someone to get you in through the door is a great start. Now, the clinical champion might not have all of the insight into the minutia, so they'll probably refer you to legal, individuals in supply chain, et cetera, to get into the various minutia. Well, you can do a operational for this amount, but anything above this amount, you have to have an RFP. If it's impacting this, you need to go through this process. So the clinical champion can help you get in and be an advocate to help guide you through, but then there'll be other individuals throughout the system that are involved to help you figure out that it depends piece.
Yes. I think sales strategies vary from company to company and obviously vary based on the product category, if it's an OR product versus maybe a less clinically differentiated product. But my advice to companies is, or to company representatives, I don't think you go to the big teaching institutions, your first day out of the door. I think you have to start small, get a quick win. I think, Jacqueline, as you presented, there are a myriad of different hospital types. And it's good to get your feet wet and get an understanding in maybe some of the less academic and larger institutions, and to get you prepared for when it comes time to go to the big behemoth, so to speak.
And I agree, and as we've heard, that could be your pilot study.
Yes.
If you have had success in a smaller system where it's easier to get access and easier to get to know people, there may not be such a giant administrative structure, and maybe that clinical champion knows the president and the CFO,
Yes.
and that's all that really needs to be done.
The barriers to entry are probably
Exactly.
less, yes.
Great. Well, we've come back to value assessment committees again. In the past 5 years or so, value analysis committees have really become a significant part of the purchasing process, decision makers and influencers in that process. From this team's perspective, can we talk a little bit about what these kinds of committees are and what role do they play?
So some of them are formal, and some of them are informal. But either way, there's usually a combination of both administrative as well as clinical leads. And by clinical leads, it might be department heads or those that are seen highly respected in their field at that institution. So I think I'll start off with that and kind of let the rest talk.
Do they vary by types of institution?
Yeah, exactly, Rehan, to your point. They might be called different things, they might have different, nomenclature, they might have different schedules, but I think it really does require, and absolutely I agree with the assistance of a clinical champion who really would understand the mechanics of a hospital. It definitely can vary. And you've got to really work to get who the members are on the value analysis. So no one's walking around the hospital with a name tag, I'm on the VAT today. I wish it were that easy. It's good old-fashioned work, and you've got to earn your way in, is what I'll say about that.
I should say, typically these are committees that are not just obstructive committees. They really are adding value to the hospital, to the system, and to patient care. I would think that it doesn't necessarily matter who's on the committee, you just have to get that inroad into the committee, and often that can be through the clinical champion who will then proceed to apply for that introduction or that first step, and it'll get you to the next steps.
Can you give us some examples of the process that products go through for a value analysis committee?
Sure. Typically, there'll be a product, say a new catheter or a new joint product that the company would like to introduce into the system. At the same time as this is happening on one side, the hospital is typically looking at their own clinical situation, purchasing from the other side. They may have 10 different products, each being used by 5 to 10% of the surgeons, for example. And as they look at the products, there's not a lot of difference in terms of quality and in clinical outcomes, but there is a lot of difference in terms of cost, and if they can combine all these things together instead of 10 different products down to 2 or 3 different products, well, that's going to add a lot of value, both in the clinical sense as well as from the financial sense. So now the process becomes which of these products is the best product, and they'll take different clinical champions, different studies, and it's important to get that clinical data as well as the financial data. But then again, it's going to be important to get buy-in. If you have the one surgeon who does 90% of the surgeries at that hospital and simply refuses to use the joint that you want, that's going to be a problem. So it's going to be a give and take where you have to have some negotiation and some understanding of the whole process.
Are different types of products subject to VAT approval? Does it have to be an FDA-approved product? Like, are there variations there as well?
Well, I think the hospital is not going to really, if we're talking about a clinical product, they're not going to be able to purchase a product that's not FDA-approved. And that process is a separate process. It's going to need to go to the IRB or the investigational board to get approval. Once there is a product that is FDA-approved, now it's going to go to the value-added committee to determine whether that's going to add something to the hospital.
I'd just add, if you've been fortunate enough to, have evaluations underway at the institution that you're targeting, so a couple of different departments have done a fairly exhaustive evaluation, you've got a clinical champion, you're getting great results with the product. I think the comments around the quality indicators being very much aligned with what the institution is looking for. your time with the VAT or the VAC is going to be much easier and the road much more successful. And I think one of the doctors has mentioned, you know, is there something coming off a formulary because your product is going on? You've got to have that all worked out. But the deeper your knowledge and the deeper your tentacles are within the institution, the more successful you're going to be through the VAC process.
The other thing to keep in mind would be security. One of the biggest things that's happening right now in healthcare is ransomware. So if you haven't heard about it, you should. But security is at the forefront, not only devices, but anything else that's being used, whether it's operational or for finance, et cetera. So keep that in mind. And then integration, I think, is very important. So does it integrate with their EMR? Does it integrate with their other products that they're currently using? If it's not, it's going to be a challenge getting it into that marketplace.
I think part of that that assessment is also what are you going to be doing to help the institution, exactly as you said, Dan, once a decision is made. That's the first step, but really laying out what's your company all about? What are you committed to? How are you going to work with us over the long term? What kind of resources do you bring around implementation, adoption, helping us train, which is critical. So that all factors into the softer side of the decision process as well.
Do company representatives present directly to a VAT, or is that the role? Is that someone else's role? Are they allowed in the room?
Typically, there may be some behind-the-scenes discussions between the company and some of the administration and purchasing people at the hospital, but the actual value-added committee is typically only the clinical champion and the clinicians that are interested in that product.
So that's good to know. So how should a company prepare for all of this, for selling to hospitals in general, for the VAT committees, to find a clinical champion? What are the things that a company really needs to do to prepare for selling to a hospital?
Well, it really is about developing a plan and being well prepared and you know, the back office support that a company offers during this process of, you know, data collection, you know, crisply developing the value proposition, getting lots of feedback around the product if it's a new product, or getting endorsement if it's an existing product. There's just a lot of preparation and work, and you know, you can't underestimate how much time this is going to be. There could be a wonderful payoff at the end in terms of being able to say that you know, a wonderful facility like UH, the Cleveland Clinic, is using my product. That's great, but the amount of work that it takes to do that is pretty awesome, and be prepared.
And from the institution side, what are they looking to manufacturers to do in the preparation process?
I think if they actually know the system, that's going to be very important. If they're coming to me and they're saying, hey, we're going to give you this great tool, and I'm like, well, I actually already have a tool. I don't need yours. I'm okay. It's not going to go over very well, versus if they're able to come and say, you know what, we actually have this great product to help cover this gap, or help a problem area that you're having, or an area to improve. That conversation goes by very differently. And if they were to say, you know, we know you're already using this, but we feel this would be better, and this is how, here's the data, here's the studies, here's how we've operationalized it, and here's someone that you can talk to actually understand how it works, that's a very different conversation. And it goes back to planning. And if you don't have a planning, if you haven't done your work, it's going to be a very, very tough conversation.
There's no easy button.
No easy button.
I don't have a lot to add. I think what both of you said is correct. I think you have to have a good product to start with. If you don't have a good product, you're really in a bad situation.
Step one, good product.
So have a good product, understand the environment, and have some real strong clinical advice in terms of how the product is going to be used in all different environments, and how you can add benefit.
That's great. I'll give everybody on our little panel here one final word. What is your parting word of wisdom for this audience on selling to hospitals?
I would say, again, just have a good product and have a strong sense of what is involved clinically. Have your own clinical staff involved, select a good, strong clinical champion, and really set up a good relationship so that you can promote your product and understand the environment.
I'd say understand the customer, understand the needs, and be prepared.
So what I would say in real estate, it's location, location, location. Here I'd say it's data, data, data. So make sure you're armed with a lot of good data in addition to what they've said.
Thank you.